welcome my fellow panelists. Cheng Kwang would be, I'll call you CK, yeah? It's all right. And Li Gang, familiar face. Dr. Arifin, I just heard that you just stepped out of the war. Well, thank you that you can make it here, and hope everything's so well for that patient. That's good, that's good. Okay. So without further ado, we'll start off this panel discussion on how to improve core capabilities to accelerate business transformation. Yeah, this is like going on everywhere right now. We're talking about digital transformation, business transformation, etc. And that means we still have a job to do, and they'll still keep us, yeah. And very interestingly, if you see this group of panelists that I have in front of me, they're all related in some way or another. Yep, if you notice it, all the four of us are connected in this panel session. You see that we have someone who is from the insurance and health industry. And we have someone who is from, who's a medical practitioner himself, okay, from a hospital. And we have someone who's here, CK is from IHIS, who is supporting the technology for healthcare. And you have me, who is probably the patient, okay? And I'll purchase the insurance. I'm also a Manulife, policy holder. So we're all connected, yeah? So let's start the session. And we all know that no two organizations is alike. But the thing is that there are certain common approaches, things that you look out for, and best practices that we can adopt in order to, do business transformation and, to help with the digital advantage. Okay, so the first thing is that perhaps we'll get the panelists to share some of their experience or involvement in business transformation, and perhaps also about their organization's journey in this. So perhaps we can have Li Gang, you'd like to start first?
Sure, thanks, Morgan. Good afternoon, everyone. This is Li Gang. I came from Manulife Singapore and have been with Manulife for more than 3 years. So if I think about where I started the journey, at that time, Manulife had a very ambitious business goals, right? So we started the business transformation 3-4 years ago. And at that time, I believe everybody is so excited about the upcoming transformation, and people have been, it's not a very hot word, right? Everybody talks about the transformation, but people may not know exactly what that means to everybody, right? So where would the transformation will bring us to? So in terms of operations, so there are different silos of business, different silos of technology. So it's a little bit scattered. So people are so excited, but people are engaged in the business transformation in a way or another. So that time, right, there was little discussion around the architecture. And to be frank, I believe that time there was even no architecture practice 4 or 5 years back then. So along the journey, over time, people realize, right, the key drivers for this business transformation is really deliver the business values, and then there's the real demand for the architecture practice, and then we gradually bring in people, right, build a strong team and get involved in all different business discussions and provide our views, our opinions, build up the trust, deliver the values, and then until date, we are able to really be part of the business conversation and influence certain business decisions. That's an interesting journey I had personally in the past few years. Yeah, so yeah, back to you, Morgan.
Oh, thank you, Li Gang. Perhaps CK, you'd like to share from your point of view some of your experience?
Yeah, hi, a very good afternoon to everyone. I'm CK. For me, I've been in IT for 30 over years already. I guess, quite unusual for, I guess, to many of you. Actually, about half of my lifetime, I was running my own business with partners. So I actually have three, business that I used to run with partners. The last one, we sold it. And the other half of my life was in SI, solution integrators with the large SIs. So I do have a different aspect view about IT implementation, that kind of thing. And currently, I'm actually serving in IHIS as introduced by Morgan. I lead the enterprise architecture team in there. And basically, it's for those who are not familiar about IHIS, is the, you can see as the kind of the IT service provider that has been appointed by MOH to help out the public healthcare institutions. All right. So yes, so my focus is all the public healthcare institutions. So if you do visit the hospitals or the polyclinic, the community hospitals, those institutions in Singapore, yes, these are all my customers. And so yes, Morgan, you'll be one of the patients, and you are indirectly my customer. And those more of direct customer or partners that I support will be people like Dr. Arifin. All right. Yes, we do that. Now, I think today we are all impacted with the ongoing COVID-19. Okay, I think it's no need to say much. Okay, everyone has been talking about it. And all the industry in the short term are forced to transform and work differently. Now, for us in public healthcare sector, okay, now the expectation is very high, and in very, very little time, all right, we have to architect mobile solutions, okay, that can be deployed in community care facilities where you get to hear in the news, where you bring in suspect or those people infected, to big place where they can, recover from there, And also we have to develop mobile apps. You probably also get to hear on the news where you can actually check your COVID-19 lab results and your vaccinations records. You're using Health Hub. Okay, so that is also a product of IHIS. And also we have to enable remote teleconsultations, because we still need to help to take care of the healthcare. You can't just say because of these disruptions, you hear from news they're discouraged to come to the hospital even during a certain period of time. But we still need to find a way to take care of those citizens, those residents. So telecommunications becomes pretty common nowadays. Okay, you hear it. So all of a sudden we transform in a very short time. And basically together with my architects, in my view, we basically have to run, okay, with other delivery teams to transform our healthcare delivery services. Yeah.
Well, that's very interesting. I think CK will be sharing a little bit more later on. So now let's go on to Dr. Arifin. Dr. Arifin has been to many different organizations, especially the hospitals. Perhaps you can give this view, a larger view of how it looks like from the places that you have been working to currently where you are now.
Hi, Morgan. Thank you very much. What do you call that? I'm very honored to be here, and thank you for inviting me to give to be part of the panel. Yeah, I'm like what CK mentioned just now. I'm actually his customer, but unfortunately in Malaysia we don't have IHIS. So that's actually one of the not so good thing about being in Malaysia. But what to do? We still have to deliver services. And just to echo back what CK mentioned just now, I mean, I'm not IT. Okay, that's the first thing I have to tell you. I'm a certified or licensed physician. I actually put people to sleep as my what do you call that? Main role, not because I'm boring, because I'm actually managing the cardiothoracic surgery. But just to share, I had to undergo a transformation because now technology has permeated, like what CK mentioned just now, into medicine. So medicine is not just about delivering care, but also engaging, communicating with people, doing telemedicine. And in fact, the COVID pandemic now actually sort of like accelerated the adoption for technology. in my current position in this hospital, I actually lead a team that looks into the governance, risk management, and also compliance for the hospital. And one of the biggest compliance that we look at is actually for the Sharia compliance for the hospital. In fact, we are actually the second university hospital who is certified as a Sharia compliant hospital, meaning that we ascribe to the ISO 1900/2014. And the reason why this is so because of the need of the stakeholders. So my unique position is that I am not just like CK and Ligang is actually IT. They are on the back end. I actually sort of like a chameleon. I move from the front end to the back end, and also do stakeholder engagement, be a technology leverage. Sometimes I have to be a knowledge entrepreneur, meaning that I use knowledge to bring people from not so productive to a more productive level. So my role is not just as a physician delivering care, but also a technology, how should I say, a technology proponent, and giving more input to the stakeholders, to the users, and also to the IT people. So if I were to, describe myself, I'm sort of like a bridge. So, but the problem with a bridge is that all the cars go above you, so you get hit by a car almost all the time. So I'm sure that CK is laughing now. You can see all the scars at the back there. But the way I look at it, it is very important for the front end or the business people to have the ability to communicate to IT, to understand what is the capability, to understand what is the core capability. And even though industries, say for example, in vertical industries are different, but the core capabilities can actually be the same. So I'm sure that after this, we're going to have a discussion on that. So back to you, Morgan.
Morgan, you're mute. You're on mute, Morgan. You need to unmute yourself.
Okay, sorry. Yeah, I have to take a quick cough just now. So, yeah, based on that, you're talking about business people need to understand the core capabilities and to have an appreciation of what's going on in the organization. So maybe you can, explain a little bit more, or what are some of these core capabilities and how it will help accelerate the business transformation.
Okay, thank you, Morgan. So I'm getting the first bullet. So medicine is changing. I remember when I was a houseman 25 years ago, probably, doctors are, demigods. Everybody listen to doctors. But nowadays, that's not the case anymore. Even in management, we have team management, we have multidisciplinary team, and patients are not just managed by a doctor, but actually a team of doctors. The main reason why that happened is because medicine now is actually specialized. Therefore, one doctor cannot do everything. Now, that is very important to understand, because this shift in the way medicine is practiced necessitates communication. And when we say we need to communicate, it communicates towards a very diverse group of people, from nurses to financials to social worker to pharmacists and things like that. So when you have this diverse group of people, each of them have their own capability. So what I'm trying to allude to is that there are certain commonalities that we need to do. For example, if we take COVID-19 pandemic now, everybody have their own work, but the commonality is that everybody have to wear PPEs or personal protective equipment when they meet the patient. So it's the same thing. Adaptability, resilience, the ability to change or to adapt when the need is needed. Because if, say for example, we refuse to wear our personal protective equipment, what happens is that you will get COVID. So change is forced upon us. Therefore, we have to adapt, and then we have to change the way we practice. It's not just practice as usual. You should try to set a granula when wearing a full PPE. It's not the same as putting it. But those are actually on the front end. But on the back end, like what CK mentioned, now telehealth, telecommunication. When we go everywhere, we have to scan everything, and then we have to go through, like the numbers that came up and things like that. So these are actually different things very diverse things, but the common thing is that everybody have to do it. Social distancing, the way we treat our colleagues, even though now we cannot shake hands and things like that. So the way I look at it, from my point of view, one of the common core capability that we have to look at is how do we build competency to adapt to change, and how we build our what you call workforce or our healthcare provider to be able to be resilient, even though the situation is very difficult, but you still can adapt and then move towards change. So I'll just stop at that and pass it back to you, Morgan.
Oh, thank you, Dr. Arifin. Lee Gang, what about your view? What are some of the core capabilities that you will be focusing on, or Manulife is focusing on?
Yeah, sure. Thanks, Morgan. I think to me, maybe the capabilities means different things. For example, first of all, I think it's more about the business driven, because every single initiative, every single conversation all starts and ends with business. So I think that's a key capability across all the functions, right? They have to work in a business driven way. That's first for the capabilities. Secondly, it's more about the self-awareness. So this is more about the having a holistic view and roadmap of the strategic goals, right? So-called the digital twin of the organization. So every time when there's some need for performing the impact analysis, every time we want to know what happens if you do what, right? When we want to test all the scenarios, we know what exactly happens and what will be impacting the entire organization. Apart from that, I think nowadays technology really matters, and especially technology becomes more and more interruptive. So it's not only about the digital capabilities, sometimes it's also interruptive to the business model itself. So we really pay a lot of attention to technology, and not only to bring up the technology, but to closely watch out what's happening in the industry, right? Apart from those things, people definitely is one of the most important element we need to look after, and we have been really focusing on building a strong team, because it does not deliver all these capabilities. It will also help us to build the future, right? So the last but not the least is more around the integration and the collaboration across different functions, and putting a little bit of governance to make sure we are working towards a single direction, and while delivering the results, right, as expected. That's the few core capabilities we are looking at.
Thank you, Lee Gang. Yeah, definitely. Those are the key areas that we should learn. It's always about people. And that has also been mentioned earlier on by Dr. Arifin. You know, it has to be connected to the business, and business need to have an empathy for it. You know, and this collaboration that we are talking about, that we basically, it is essential. If we cannot work alone anymore. Yeah. Maybe CK, you want to share some of the approaches or the approaches that help you in IHIS to accelerate business transformation. Especially, I understand there's a lot of things going on, and as a Singaporean, I get to see new updates of the application. You know, the apps, Trace Together apps, the health apps, and there's so many features in there all the time. So yeah, I do not know what else will be inside, and hopefully it's not a tracker where I can be tracked by my wife. So do share something.
Definitely it's not.
Okay, that's all right. So what are some of the approaches, because you have to turn things around quite quickly, and it's expected like to be out in 2 days, and so how is this handled?
Well, there are definitely a lot of factors, a lot of things we need to do around core capabilities. What I can share are some. There are three in my at this moment in my mind. One is, first is the behavior. All right, I think it's very important. You need to inculcate, the behavior change towards transformation. I think it's not just for IT, but I guess even with Dr. Arifin and even with Lee Gang and even Morgan yourself, you'll find that whether you're the direct consumer, indirect, you have to basically embrace it. It's not a choice of yours. It's definitely a lot of discomfort. But while we are trying to do that, we also want to basically endorse such positive change. And it's important as such, to basically, for instance, get employees, that is to be seen, highly visible to other colleagues that they are actually doing all these differently. And then you want to reinforce that. So, you publish it out, you share with people, say, hey, see, we can do it this way. So that people actually don't fear. In fact, they embrace it because they see a positive and a support from even the management recognition to say, hey, let's change, let's do the right thing. All right. I think the second thing I would say is actually knowledge, especially if I reflect upon how IHIS is able to respond so quickly. It's really, like what we always say, you don't know what you don't know, right?
Mm.
And what is important then, the question is, how do we close the gap? I think it's very important that in that case for us, what in our architect office, what we did is, for instance, we actually procure research studies from Gartner, O'Reilly, to learn about new technology, new trends, so that we know, oh, these are being practiced, or these can be done, so that we apply those learned knowledge into this kind of situations. So you have to quickly be more adaptive. So I think knowledge, we are even more hungry than ever. The third one that I think also will be important, and I attribute it to success, is engagement. You will never succeed if you think you're going to be that one magical person, that one boss, or that one team and deliver. It's an engagement between not just your partners, your customers. It is a totality. You need to engage them, because they need to know what it means. Everyone has to be involved, to make that changes. So I think we spend quite a bit of time in engagement, and maybe at the end people just see as simple as maybe for instance like what you mentioned, or you get to see this health hub app, mobile app that's available. But what goes behind the scene, actually, if you take note, there was a lot of mass communication on the media, advertising, so that people know how to do it, how to use it. And we also go direct to, involve with even, the labs, company, to make sure they contribute the results and work with them. So there's a lot of partners who, who are not seen in the front, but actually behind the scene, they're actually working, with those IT consulting firms, advising us how we can make those changes improve. We're working very closely with them. And I think thanks to all everyone engaging it, I think that's how we make it happen. Yeah.
Well, thank you. I think all our panelists, all three panelists actually have the same approach and the idea that it all resonates with people. And it's with people, it's the behavior, it's the knowledge, it's how you engage with them, the behavior, it's all that. Yeah. So then maybe I'll go with Li Gang now. Li Gang, so how would you, or what are some of these challenges, and how do we, well, we are embarking on a organization-wide transformation. So what are some of these obstacles or challenges when we want to, improve on the core capabilities, and what are some of them, and how do we overcome them? From your experience, you may face some of these challenges. So what are they, and how do we look out for them, and how can we overcome them?
Yeah, sure. Thanks, Morgan. I believe definitely, I think for each of the organizations, the challenge can be unique. It can be very different, right? Personally, I did experience a lot of challenges. Even today, people do not want to work out of the comfort zone, and people do not embrace change, so on and so forth, right? So I mean, not wants to elaborate all the challenges, but I would like to share my experience about how can we resolve those challenges, right? A few things. First of all, I think it's very important for us to have this so-called the division. So we have to really think big, to really think out of the box to see what we really want to achieve by the end of the transformation journey. So that with that vision, then we can really inspire people, and we can also motivate people. So that's the common target we want to work towards with. So we always encourage people to think big, right? So secondly, I think we always have to challenge the status quo. because I do like the concept of dual transformation, right? The transformation A, transformation B. Transformation A looks at continuous improvement for the current business, while for transformation B, look for new business models and new opportunities, or even disruptive opportunities. So we can always find a way to do things maybe not 10 or 20% better compared with what we had yesterday, but even 100 or 200% better than what we did, right? So I think that's a spirit of challenges that always really matters in today's world, right? Another point I would like to highlight is that sometimes we also encourage people to have an open mindset, and we also encourage people to have a so-called growth mindset, because the way we look at things, the way we look at change may lead to different results, right? If you do see the challenges, of course, you have a lot of problems in delivering your goals. But if you view those as opportunities instead, right, you may end up with totally different positive results. Right. So the last point I would like to share is that we do really focus on the execution excellence, because as architects, right, we do have a holistic view, and we try to plan all the different things. But what matters at the end of the day is what we deliver, what business value we create. So the execution excellence is one of the most important elements I would like to highlight. Right. Yeah, back to you, Morgan.
Okay, thank you, Li Gang. Yeah, you actually put it into perspective. First of all, we look at vision, and where this is where it all comes down to. And we have been even CK and Dr. Arifin also has mentioned it's business driven, it's business focus and all that. So all the capabilities need to be identified in order to be able to provide that to the business. And that's where you're saying execution excellence comes in. It's to deliver that value back to the business by achieving those capabilities, fulfilling that. So yes, thank you so much. And Dr. Arifin, you'd like to add on to this?
Oh, yeah, I was muted just now. Yeah, sure, Morgan. Yeah, I totally agree with what Li Gang mentioned just now. To me, I would like to summarize it as focus and direction, because the problem that I face now, which I'm sure that maybe CK and Li Gang also face, all the mission, vision, those are actually abstract concepts that when you look at, when anybody who is in operations, I'm not referring to just operating theater, but those delivering the service, they don't see it as something concrete. So the challenge for architects is actually because the architects have got the viewpoints, but what they need to do now is actually give the views of the the views that will engage the staff or the people who is working. And if I were to give my example, the hospital have got like 5 capability that we have identified in our strategic plan. But our core capability is actually about ensuring that the environment of care is safe. So that is the main or overarching view that we have. From that, it's sort of like disperses to a few capabilities, and these have to be reflected back to the patient in terms of centricity, patient safety, staff safety, and all these have to be translated to something actionable. So what we do is actually looking into just to translate Li Gang mentioned just now in terms of the vision, thinking out of the box, looking at strategy and mission and things like that. So what we do is that we translate the strategy leads to capability. You have capability increment, because of what you need to do is to have the capability literally to run or to carry out the mission to achieve the vision. So therefore, you have to build up the increments, and these increments are translated as work packages. These are the things that we have to do to build our competency, to build our processes, or to build or optimize our resources so that we can deliver the value. And the value that we look at now here is actually about ensuring patient safety. Not only just ensuring patient safety, but you also have to ensure the staff is safe, because with what is happening now, healthcare workers are actually exposed or is living dangerously of acquiring COVID. Like, for example, me. I've had COVID and I spent like 5 days in ICU. But that's not because I didn't adhere to the protocol or I didn't wear my PPE, but because it's from the community, essentially. So now we have a group of people that is what do you call the at risk. Therefore, we have to translate it back. The competency building, the staff safety, the patient safety is not about something abstract, like for example, like what we are doing audit now. Before this, when we do our quality audit or risk assessment, we do it because we are looking at the risk register and things like that. But now what we are doing now is that we are looking at how the staff is complying to the standard operating procedures in terms of personal protective equipment, in trying to allow or prevent intra-hospital transmission of COVID. So those are the things that is more tangible and not as abstract. So therefore the staff now know the transformation occurs for their own sake, for example. So back to you, Morgan.
Well, thank you. Thank you for connecting that from strategy into actionable work packages. And that is the core of things. Capability puts it into perspective as to what needs to be achieved and how they are to be achieved. Yes. And then incremental, yeah, we can never do it like overnight, but the thing is that it has to be a roadmap for it, a plan for it. So that's where architecture comes in, taking the bits out into the different smaller work packages to fulfill. Well, thank you for that connection.
You're welcome.
CK, you like to add on to that?
Very interesting insights. I just would like to just probably share an experience that I encountered. And what Dr. Arifin was saying, where you can set your vision, but how do you actually execute it? It happens to one of my institution actually. They actually wanted to, they visualized that I want to actually embrace what we call API economy. So what it means is that every systems, because they have a set of interfaces.
Yeah.
So what in their view is that since I have interfaces, if I build this API economy, I should be able to reuse them, and then I can churn out new applications for different business needs faster. Now, of course, they were excited. They set the vision and they put in their work plan and said that is where we want to go. Of course, as an architect, we help to support. I said put it in. So they invested. They put in all the hardware, the technology. But I guess this is where the gaps is. A lot of us as architect, we put in those nice things, but we don't think hard enough, in terms of the operationalizing part. It doesn't work. So quite naturally, they invested. Then the next moment they look at everyone and say, so where are we in API economy? And the answer is the build effort to build a new application still take the same old time, still didn't improve, and they still can't reuse. So everyone is just saying, what is happening? Everyone is just looking. So for me, this is where I engage the management. And I say, this is again what I call change behavior. You need to do different. So they say, what do you mean? I put API economy, I use the API, isn't that change behavior? I say, no, you just put the hard part. The soft part that I need is, you look at here, I need for every system, every project moving forward now, okay, is to have what we call API contracts. That means I want a commitment from each project, each system that they are going to build or develop. What are the APIs they will actually publish and put on this API gateway? So that imagine you start with one, and as you go and move on, into the future, you get more and more libraries of this API. Then you'll be nearer to the goal, the vision that you want to attain as API economy. So that is one thing you need to do. The second thing that you can actually immediately do, okay, to make this kind of kick off or warm up this whole API economy is, for existing system, there are also a lot of web services, interfaces they have built. Get them, spend time, focus, and then say, what are these interfaces you are prepared to share? Ask them, and again, same thing, commit that so that we spend not a lot, just some resources, some effort and then publish onto this API gateway.
Mhm.
Instead of waiting until the new system or new project finish, then you have. So there are a few ways to tackle this, and then you can see the whole thing happening. So that is where I tend to agree with Dr. Arifin earlier, where this is where vision needs to be executable, and this is where architects actually can help to work with the delivery teams to make things work differently. So this is one example working differently. And of course, when I talk about management, this will brings me to the other interesting challenge. I guess I've not heard from Li Gang mentioning that also, but I thought it may be similar for him, because for us in IHES, we serve multiple institutions, different hospitals, all that, and each of them have different priorities. They have different business model and strategy, okay, and focus. And imagine when we serve them, okay, to ask them to focus, let's say even in COVID situation, to get all to them together, each of them will say, this is more important, that is more important. But IHES, though not a small organization, but the resources are still limited. There are so many requests. Then the thing is, so what do we do? Given the limited, what are the priorities? What to transform? And this is also where I think we also have undergone a change in our organization. We have actually kind of restructured a bit, okay, and to better serve all this, so that we will support those more urgent, I would say immediate requests that need to be done. It cannot be like the old days where you just queue your request, and at the same time, look at things that can be done immediately within the 1 year one, and put in the work plan so that we put focus on it, because we need to focus that. Then we'll be able to show and work with the healthcare institutions to achieve their goals. Yeah.
Well, thank you, CK, for highlighting that. That's where architects comes in to help orchestrate all these requirements and needs, and to basically have a harmonious way of working, so that things can be prioritized. Yes, we are indeed always short of resources. That's almost everywhere, and how we can maximize through managing it properly and orchestrating it properly with the architects. Yeah. Well, thank you for that. I think our time is there's a little bit more time. So very quick last question.
Sorry, Morgan, can I explain a few points, right? I would like to add a few
yes, please.
comments, right? So to share my experience. So basically what we be trying to do is, when you look at transformations, it does not only happen in technology. It's not about adopting a new architecture style, a new practice. It's not only happens in the business layer, right? So every single competence goes hands in hands. So in general, we try to walk away from the traditional kind of top-down approach, have a centralized control body, right? We know what we want to execute in the business layer, and then we get the technology people and the architects work on the solutions, and then just get the execution and deliver. That the whole world changed, right? The change comes so unexpected, so much uncertainty, and we cannot manage the changes in a centralized way or with a tight control. So what we're trying to do is to empower the team, right? So we did a lot of transformation, especially we want to shift the culture to change the way people work together. And we want to definitely we embrace change, we embrace failure even. We want to fail early if it does not work, right? Then so that we can control the damage. So we did a few layers of transformation, and then so that every team can fully own, or every function can fully own their business vision and their business outcome, and then you can feel free. They are empowered with certain freedom to try things out. As long as the corporate level, we have the so-called holistic view. We know the direction we are heading to, and we have the proper control over those. So I think that's one of the key changes I observe or we drive in the past few years.
Okay, so perhaps you can stay on here. So for organization who wants to accelerate their business transformation, what advice would you give them to start off right? Maybe just a short answer will do. what's one thing you think that you would like to give them and advise them that this is what you need to keep in mind in order to do it right?
Yeah, to me, it's all around people. Get the right people and give people room.
Okay, give them a room. Right? Okay. What about CK?
Wow, that's a really, really difficult question. Well, you said give one advice. I wouldn't say it's a really advice. Based on what I've seen so far, I think when we talk about transformation, I've seen many times a lot of organizations tend to be badly distracted by other priorities, such as ongoing operations and worry about missing out certain opportunities and hesitant to to go into those changes.
Okay.
And thinking and reflecting from that, I thought first thing, of course, they need to basically understand is that when we talk about transformation, it's not just going beyond just setting up aspirations, setting just visions. It's fundamentally what I'm trying to emphasize is it's a change in how the works get done. Okay, and if you want to make that change, don't be ambitious, especially if you are new to transformation, especially if you come to organizations where people have never really transformed for the longest time. You probably want to start small first. Start something that you are in control and resources that you have a say, work on those. Use that as a model to show people how it's transformed. And once you taste the benefit of having this transformation brings, I think then you'll be able to convince bigger group of audience, influence your peers to come in and transform. Yeah.
Yes, spoken like a true strategist here, because that's how you approach. Yeah. Dr. Arifin, your thoughts, or what would you give?
Yeah, my thoughts. I would just, to sum it up, I like the quote from Einstein, the definition of insanity, meaning that you are doing the same thing, but expecting a different result. So the first thing that I would say is that transformation is complex. You have to have specific goals. And because it's complex, you need to have blueprints. And that's the reason why you need to build people to build the blueprint. And then after that, engage the stakeholders, because we don't want to say that we are transforming, but at the end of the day, the stakeholders say, no, this is not what we want. And to me, that is actually the core capability that you have to acquire. So that's actually my thought, Morgan.
Oh, thank you, Dr. Arifin. Yes, ladies and gentlemen, thank you for being here with us. And I would like to thank the panelists, CK, Lee Gang, Dr. Arifin. They've actually framed it in such a way that these are the essentials that we need to do. We need to, look at the people that's around us that's going to support this transformation journey. And not only that, we need to be able to look into it and itemize it into actionable items that we can run. So end of the day, we are able to, incrementally build the capabilities and support and bring business value back to the business. Well, thank you so much.